This meeting is being recorded.
Good morning and welcome to Black Maternal Health, a call to action. Today, April 12th, 2022. Each year, Black Maternal Health Week is recognized from April 11th through the 17th to bring awareness to Black maternal health. I'd like to welcome you and I'd like to introduce our CEO of the YWCA of Central Mass, Deborah Hall.
Thank you. Thank you so much, Maritza, and welcome everyone to the second in our series on Black maternal health. Today's session is a call to action. And as Maritza explained, April 11th is officially the beginning of Black Maternal Health Month. Pregnancy and childbirth should be a dignified, safe, and joyful experience for all. For far too many mothers, however, complications related to pregnancy, childbirth, and postpartum can lead to devastating health outcomes, including hundreds of deaths each year. This maternal health crisis is particularly devastating for Black women, who are more than 3 times as likely to die from pregnancy-related complications as white women, regardless of their income or education. During Black Maternal Health Week, we renew our commitment here at YWCA to addressing the crisis of Black maternal mortality and morbidity across Worcester and the Commonwealth. I'm looking forward to hearing from these wonderful panelists today and hearing what our call to action is. So thank you again for joining us. We hope you have a great time and get lots of information.
Thank you so much, Deborah. So in our part 1 of Black maternal health and infant mortality, we had informed of the significant racial disparities in maternal morbidity and mortality existence in the United States and here in Massachusetts. As Deb had just stated that Black women are more than 3 times more likely to die from pregnancy-related cause than white women do. And we are the only industrialized nation where Black maternal health is getting worse. Think about that, where it's getting worse instead of improving. Given these disturbing trends, growing attention has focused on reducing racial and ethnic disparities in maternal morbidity and mortality rates in the United States. The fact that the risk of pregnancy-related death for Black women in some regions of the United States is the same risk for women in some developing countries has finally alarmed health professionals, patients, and policymakers. There is insufficient investment in the health and well-being of women and families in this country. Multiple factors contribute to these disparities, such as variation in quality health care. Social determinants of health prevent many people from racial and ethnic minoritized groups from having fair opportunities for economic, physical, and emotional health. This is a direct outcome of the USA history and its legacy of racism. This morning, our presenters will speak on the efforts to reverse the worsening trend for our Black mothers here in the city of Worcester and Massachusetts. Growing research indicates that a comprehensive approach to quality improvement throughout the care continuum, from preconception to postpartum and into pregnancy care, is required. It is a must to reduce racial and ethnic disparities in severe maternal morbidity and mortality rates, not only for Black mothers, but for all racial ethnic minoritized women. So with no further ado, I will introduce our Director of Health and Wellness Equity here at the YWCA of Central Massachusetts, Jermoh Kamara.
Thank you so much, Maritza, and good morning to everybody on this presentation Zoom today. Please note that this is going to last for 60 minutes until 12 noon, and we have for you 3 wonderful panelists here who are from our community here in Worcester. Each of them will have 15 minutes to present to us. One panelist will have 5 minutes, which will segue into another panelist speaking, as an interaction together. And our first panelist is Dr. Claudia Pierre. And so Dr. Pierre is an OB fellowship trained family medicine physician practicing full spectrum family medicine, including maternal care. That includes performing C-sections. She works at the Family Health Center of Worcester and is a leader of the prenatal services there. She also provides maternal care at UMass Memorial and is a part of the UMass Memorial Maternal Anti-Racism Task Force. She is a faculty member of the UMass Family Medicine Residency Program, as well as an assistant professor at the UMass Medical School. And she teaches family medicine residents as well as medical students as part of her several UMass anti-racism, oppression, diversity, and inclusion group. And so for each of our panelists, I will have a question and then they will take it from there. So Dr. Pierre, welcome. And for you, my question is, in your opinion, as it relates to your practice, what are 3 strategies that can be implemented or enhanced at the hospital and community level that could curtail complications faced by Black mothers during childbirth?
Okay, may I answer that with my presentation, or should I just answer it in general?
Your presentation would be superb.
Okay, okay, so let me share screen. Go to slideshow. Slideshow. Okay, so how do I make this smaller? Okay. Improving maternal health for patients of color. And I wanted to talk about, to answer the question, what I think is already being done, and then what, things should we focus on. So, of course, things I think that are already being done is education and training of all maternity care providers, including learners in training, meaning that I know for a fact UMass Med School is teaching both nursing students and medical students about implicit bias, microaggressions, and then of course, providers, including nurses, social workers, and attendings are learning the same things and how to, you have to be aware of the issues to better provide care. As mentioned, there is the UMass Memorial Health Center started a maternity center anti-racism task force, which I'll get more into what they have done. The hospital has also started a project called Teen Birth, which I'll also get into a little bit what that's about. And then my clinic, Family Health Center of Worcester, has a perinatal team that includes OB advocates that I'll get into what that entails. And we know there's a lot of community agencies out in Worcester, the Worcester Healthy Baby Collaborative, the YWCA, Essentia, the REACT, Refugee Immigrant and Assistance Center, WIC, and then McPack for Moms, as well as
Dr. Pierre, if I may interrupt you, your slides are not visible on screen.
Oh no. Okay, I don't know how to fix that. I thought I was sharing.
Perhaps.
There we go.
You can see me now.
We can see you, yes. So if you'd like to just continue and just read off your slides, that would be fine. Or hit enable content.
Can you see it now or no?
No.
Oh, I'm sorry. Okay, so I'll kind of just read off my slides. Sorry.
All right.
In regards to the Maternity Center Anti-Racism Task Force.
I'm sorry, ma'am. You have to click enable editing at the top of it.
Oh, okay. That's the issue. Sorry. Okay. I'm not tech savvy, people. Sorry.
That's all right. It happens to the best of us, believe me.
Okay. And now go to slideshow mode. Oh, I don't know what this is about. Okay. Okay, hold on. Now I lost you guys. Oh, okay, so now I'll go back to screen share, I guess.
Yes.
You can see it now?
There we go, yes.
Okay, let me put it into this. Okay, so, okay, so
Perfect.
the UMass Maternity Center Anti-Racism Task Force consists of OBGYN and FM attendings and residents, as well as maternity nurses and social workers. Some of the things we've done is, which was advertised, you can see a picture of that. The Maternity Center has a statement about racism and discrimination, and a lot of maternity staff and providers signed that, and that is a picture from the event, as well as one of the directors of the Maternity Task Force, Dr. Lou Ireland. And then other things, goals and achievements, we're trying to make the environment of the Maternity Center more inviting. With that statement, you'll see Team Birth, I'll get into, changing the artwork that was around that was very Eurocentric. We're discussing and training members of microaggressions. We've had a town hall, we've done surveys amongst ourselves and patients. We have a resource library for residents and staff to use to even get more educated about racial issues. And definitely we focus on increasing the use of, as well as the proper use of interpreters for our non-English speaking patients who are usually patients of color. And then we recently held a community summit on racial equity maternity care that I believe some of you here in attendance actually attended, where it included community agency workers, as well as maternity care providers and UMass medical students. Team Birth is something designed to improve the well-being of mothers through structured communication and efficient, I feel like I missed the word, through structured communication and efficient shared decision-making methods to enhance teamwork among people giving birth and those caring for them. And basically, there's these dry erase boards in L&D rooms, as well as postpartum maternity rooms, where on the boards, you can list the team members, patient preferences, as well as what they would like to be called, both the patient and their partner or support person, I should say. Any notes, the progress of labor, the plan, and the next time you're doing these huddles, like where the huddles consist of not just the patient and the nurse, but the team. And patients are allowed to write things of preferences like they want the dad to cut the cord, or they want to try to do a natural delivery, no epidural if possible. So it gives the patient, it puts the patient at the center of the maternity care and gives them a voice. And there are there's these boards that can be available in different languages, of course. And then there's a postpartum planning version, which of course includes the same, but it includes the baby. So it says things, about breastfeeding only, no pacifiers, desires circumcision, and once again, you're writing the names of the baby, the names of the team members, and the plan. And then I had trouble because I'm not tech savvy. I was trying to get images of these planning boards, but that was a little too hard for me to figure out. And I already did have assistance with the way this presentation looks today. Some of the data from Team Birth already suggests that it's improving the experience of Black and Latin ex-women specifically, because of course we've gotten surveys from patients and patient testimonials about how they do appreciate that, and they felt that it gave them more of a voice in their maternity care and experience. And the Family Health Center of Worcester's pioneer team, which I'm a part of, this is just some of the things we do. That's something called OB intake, which is basically a pregnant woman's first appointment with our midwife, as well as an OB nurse. And that is basically, besides doing the medical stuff, getting the patient's history and the partner's history, it makes sure they have mass health if they need it, WIC, and other resources. They are assigned a prenatal care provider, as well as someone called an OB advocate, which all our OB advocates are bilingual. We have Viennese, Spanish, Twi, which is a Ghanaian dialect. In the past, which we unfortunately lost, we had Arabic, and then we in the past have Portuguese, which we're trying to get back. And these advocates are with these patients throughout the pregnancy, as well as the pair of them, I'm missing a B there, until the baby reaches 2 years old. And this person is basically guiding them through this process of maternity care and being in the 2 early years of the baby, right? Because reminding them about not only prenatal appointments, but OB ultrasound appointments, well child visits, touching base with them if they've missed an appointment to make sure everything's going okay. They actually do some even education, like they'll start the birth control, contraception talk. They make sure they have resources and let the team know if They can really use baby supplies or help with that, help with food, like, resources to food pantries. If they, even like test results, oh, you failed your sugar test, you need to come in. And they basically act as a liaison for the patient. And if the language is matched, that is also very, helpful, because the patient will feel comfortable with that person and let us know what's going on and what their needs are. This perinatal team does case management. We meet regularly every other week to talk about any, difficult cases or cases that are medically complicated. We have something that is called the baby store, which is not really a store because patients don't have to pay. It is a dedicated space in our perinatal center unit, I like to say, or suite, that has a lot of baby clothes, diapers, supplies, that patients, I think is nice, pretty much at the time of intake or at the prenatal visit can stop by and basically gather the supplies they need. And can always use donations. I heard particularly we need some boy clothes. We have a lot of girl clothes, but boy clothes up to 2 years old. There's a baby cafe, which I know other people are going to speak in, which is breastfeeding support. And, I didn't even say Family Health Center of Worcester has also done centering pregnancy, which is group prenatal care. And of course, our perinatal team works very closely with our clinic's behavioral health to provide mental support. And if we need more than that, there's always MCPAP. And then because of the influx of refugees, our clinic has a refugee clinic and team who, help us with any refugee pregnant patients. And this is to speak of what still can be done, right? Of course, we have to continue to educate and train all maternity care providers, including the learners and trainers, medical students as well as nurses. Continue efforts to diversify the maternity care staff and providers. I know, me personally, I've witnessed there's been an increase in the diversity of maternity nurses. I believe it'll take a while to get more diverse providers. And I think, of course, if we can increase the diversity and of OB advocates and doulas, which I know is also going to be speak on, and if hopefully they're bilingual, that would help. We could definitely support our pregnant patients of color. And then, of course, something that I'm hoping the maternity task force will take on is strengthening the connections between the different maternity care centers, particularly UMass Memorial's OB clinics, Family Health Center of Worcester, we call it Queen Street, and then Edward M. Kennedy, which is another FQHC, Federally Qualified Community Health Center. So they also have a lot of immigrants and refugees of color and have a high pregnancy prenatal population. And then strengthening, like pooling our resources and sharing of ideas, and then also connecting with community agencies that were listed earlier that are helping the same women. And so this slide pretty much answers the original question, which is more than 3, but these are the 4 things I think, we would help improve the maternal health of all patients of color. And I know I talked fast, sorry.
Thank you. So this is a wonderful presentation, and I think one of the main, I guess, takeaway of this in terms of there being a strategy to really support Black maternal women at the hospital-based level, even at the community hospital-based level, like you rightfully mentioned, was having diverse health workers like midwives, that doulas, and that's the next topic coming on that we're going to be discussing with the next presenters, doulas, and training these health workers to really work together and then to be able to support the care of Black women, and with more research into that, that can allow the health of women, especially Black women, as this topic is about, to see a change in their health outcomes. And I'm aware that you are also one of the only Black OB, health worker doctors at Family Health that so many, minority too.
Oh, yeah. Okay, well, the Family Health Center of Worcester, probably, right. Yeah, but I believe in Worcester, it is just me and Dr. Josephine Fowler, retired maternity care, because I'm pretty sure, I don't believe there's any vacancies. Maternity care.
Right. So this is also for the audience, when we get into the Q&A session, just to ask, questions. Without further ado, I will then now to really to focus on or to introduce our next panelist. And we've learned from Dr. Pierre at the hospital level and the community-based hospital level, and Penelope Karambinakis is from our city health department, Worcester Department of Public Health, and she is the breastfeeding and early childhood nutrition coordinator for the REACH project at the city of Worcester Division of Public Health. She graduated in 2013 with a bachelor's of science in health sciences from MCPHS University, and has pursued her interest in prenatal health throughout her career. She served as a program assistant for and with the South Central Massachusetts WIC program, serving pregnant women and families with children under the age of 5 in the Webster and Wheatonville communities for 2 years. She has served in the city of Worcester in her current role for the past 3 years. And Penny has completed her DONA International Doula Training with Lorenza Holt, our next presenter, and is after Penelope, of course, they will be going together, and is currently pursuing her certificate in lactation counseling. And so thank you, and you can take it from there.
Great, thank you for that introduction, and thank you for having us on this important panel today. So I'll be sharing about.
Yes, I just wanted to pose a question to you, and I know that we've talked about this. So the question that we have to pose right now is, how can the next REACH grant, we understand that the current REACH grant is a 5 years grant, but my question is, how can the next REACH grant serve as a foundation to be inclusive of providing support for Black mothers and their Black babies?
Yeah, and that's a great and important question. And so I'll be talking about the REACH grant as it is currently in our partnerships to address health disparities and support breastfeeding in Worcester's Latinx community. And we're hoping that as we continue to apply for grants as the City of Worcester Division of Public Health and reapply for this REACH grant, that we can include the Black community explicitly as our priority population. So thanks for that great question. Give me a second as I share my slides. All right. And so for those who don't know about the REACH grant, REACH stands for Racial and Ethnic Approaches to Community Health. It's a 5-year CDC-funded cooperative agreement aimed to reduce racial and ethnic health disparities. Here in the city of Worcester, the REACH grant focuses on the health of the Latinx community, and our breastfeeding strategies are designed to increase culturally relevant breastfeeding care and promote breastfeeding resources in our community. And before I move on, I just want to reaffirm that how we talk about race, gender, and identity matters, that Latinx identities encompass a diversity of cultures, languages, and racial identities, that people of varying gender identities can give birth and do give birth, and affirming that, and also that our racist systems are responsible for the disparities and negative health outcomes we see in our communities. And again, the overview of REACH, it includes food system, physical activity, breastfeeding, nutrition standards, and community clinical linkages as a chronic disease prevention strategy here in the city of Worcester. To accomplish our breastfeeding strategies, the REACH grant has partnered with a number of Worcester-based organizations and created many different projects and interventions. 2 community resources I want to highlight and share with you today are the Family Health Center Baby Cafe and the Worcester Resource Breastfeeding Flyer created through Worcester Healthy Baby Collaborative. So Baby Cafe is a virtual breastfeeding support group for people in all stages of their breastfeeding journey, from early pregnancy all the way up to meeting your breastfeeding goal. Through our partnership, Reach was able to support the expansion of Baby Cafe's hours and create a new session with support available exclusively in Spanish. And through our partnership with Worcester Healthy Baby Collaborative, we were able to create a list of comprehensive breastfeeding resources available to those in the city of Worcester. They include support groups, lactation worm lines, and WIC breastfeeding peer support. So these flyers will be shared, I believe, in the chat and also as a follow-up email, and are available in English and in Spanish. And as we continue to explore how to best support breastfeeding, the role of doulas consistently came up as a best strategy and a really effective strategy in not only supporting early breastfeeding, but also improving a number of maternal health outcomes. So we were lucky enough to work with a company, Doula Care, and have some key informant interviews with a number of community and perinatal health stakeholders. As a result of this key informant interview and the report, we discovered that creating a doula workforce is a good first step in the integration of doulas into our perinatal health systems. And so the REACH grant has been able to support 15 scholarships for the DONA certified doula training, which is the first step in becoming a certified doula through DONA. Lorenza Holt will be our trainer for that strategy. We were able to intentionally recruit 15 doulas that represent people and the needs of our community. So some of the languages our doulas speak are bilingual and include Spanish, Portuguese, Yoruba, Twi, Hindu, Chinese, and French Creole. And I would like to continue our conversation about the important roles of doulas with Lorenza Holt. So welcome, Lorenza. Lorenza is a birth advocate and has been for over 25 years. Her roles have included founding and directing the Cambridge Doula Program, co-founding a company, Doula Care. She is a DONA approved trainer and a Spinning Babies approved trainer. And am I missing anything, Lorenza?
No, go for it.
Perfect, perfect. Happy to be with you.
Thank you. So now I'm going to share my slides. Hello, everybody. My name is Lorenza Holt. I am a trainer. I've been doing birth work for over, I don't know, 25 or so years, and just training doulas and working with doulas for 25 years in the greater Boston area. And I'm honored and thrilled to be here today. Thank you to the YWCA for inviting me to this event and to this call of action. What I was asked was to sort of start giving an overview of what is a doula, what is a community doula. And so a doula is a non-medical provider. So we accompany and we support a family in the home, in the community, and in their birth setting of choice. Doulas do not provide medical care or clinical care, and we do not provide medical advice, but we do support the family through the full spectrum of pregnancy, labor, birth, and the postpartum months. As doulas from the community, our intention is to provide linguistic and cultural competent care. So we speak the language, we understand the culture of the families that we are serving. And in our work, we provide emotional support, physical comfort, informational support. And when the birthing families or our clients are in labor, we provide continuous presence during the labor and birth. This allows for building a trusting relationship, really understanding the needs of the family, their fears, their concerns, their preferences. And really, when you bring a doula into the equation, communication is improved. There's just a lot of benefits. We also, by being in the community and part of the community and understanding the language of and culture of the people we are serving, we can help our clients connect the family to connect the community resources and additional services. We understand enough about pregnancy, labor, birth, postpartum, that we can help our clients better understand what the medical providers are telling them. And so by being integrated into the healthcare team, doulas can do a better job at helping our families navigate our complex healthcare systems. I was also asked to distinguish what is the difference between a doula and a midwife, because this is a question that is often asked. A midwife is a clinician, is a medical provider like the OB or the family medicine doctor. As midwives, they are experts in what is the lifespan of reproductive health in a person's life, and they provide prenatal care or care for families during the course of pregnancy, during labor and birth, and in assessing the normal newborn postpartum. There are 3 levels of training for midwives. There are certified nurse midwives. They are trained as nurses, but also have an advanced degree, either a master's or a doctorate degree in nursing and midwifery. And in Massachusetts, certified nurse midwives attend births at hospitals. Not all hospitals offer midwives, like UMass Medical does not have midwives as part of their team of care providers. Certified professional midwives are not nurses, but they do have a graduate level degree in training in midwifery. And certified professional midwives usually attend births in the home, and in some states it could be that they're attending births in a freestanding birth center. A certified midwife also is not a nurse and has a postgraduate degree and training, a lot of apprenticeship type of learning in midwifery, and they attend births at home. So what I really like midwives. I think that they provide really wonderful care, and their approach is to really understand and prioritize and practice the holistic care, the physical, emotional, psychological. Really, most midwifery visits last longer than the visits with an OB, just the way that our healthcare system is structured. And so midwives are really trained to see the normal physiologic birth experience and can support an individual from the beginning of menstruation through menopause. What is an obstetrician? Like Dr. Pierre, an obstetrician is a clinician and a medical doctor with a specialty in obstetrics. Dr. Pierre has a specialty in family medicine. So an obstetrician will specialize in managing the complicated pregnancies and the complicated labors and births, but can also support uncomplicated labor and births or uncomplicated pregnancies. As medical doctors, they are the ones who perform cesarean birth surgeries, and obstetricians only attend births in hospitals. And so they understand, prioritize, and practice really the medical complications and the medical interventions. That becomes their specialty. So trying to address the health inequities that exist across the United States, the city of Worcester is being proactive through their REACH grant, through their OB advocates. And so I've been working with the REACH project actually now for a couple of years, where I first trained the Worcester family OB advocates as doulas and the staff at the REACH project as doulas. So that's the training that Penelope attended. In the grant that we've got coming up, for this 2022 REACH grant cycle, we will be training 15 community doulas. That training will begin at the end of April and go into mid-May. It will be a 6-day training, and we have screened and selected 6 Latinx doulas 4 doulas of African descent, 4 of African American descent, 2 Haitian, and 1 white American, who is working with the refugee community at this point in time and doing some really incredible work. They will be trained as birth doulas, and they will also receive basic breastfeeding support training. We're hoping that in 2023, the grant will provide additional training for these doulas, and we're still working to determine what other initiatives the REACH project will focus on in 2023. Training doulas is really important, but also once you've trained these 15 amazing doulas, then what? And so we've been saying, let's make sure that these doulas will have employment opportunities. So we've been working with UMass Medical, and they're working with their philanthropy department. So the conversations that we're having at this point in time is that hopefully about half of these doulas that get trained this year will be hired by UMass Medical Center in a new hospital-based program that we will be developing, supporting UMass Medical. So it's very exciting. Yes, the Family Health Center of Worcester, or Worcester Family Health, as I called it probably incorrectly here, they have the OB advocates. And I think they're in the process of hiring a Portuguese-speaking advocate that hopefully will attend the training that will be offered later on this month. We're also starting to have communications with the Edward M. Kennedy Center to see, is there any chance that this community center could start hiring some of these doulas? They had OB advocates in the past, but because of funding grants ending, they weren't able to continue with that program. But it's an exciting time because Mass Health is saying that they're going to start covering the services of doula. So it's going to be a reimbursable service, hopefully in 2023. And with this influx of funding from Mass Health, then we're hoping that a community health center like Edward M. Kennedy would be able to invest in doulas as well. Through the REACH project, we're going to be reaching out to WIC and the Worcester Healthy Baby Collaborative and other community groups that might be able to hire and employ these doulas. What are the topics that are covered in a doula training? Well, doulas are trained definitely as paraprofessionals, and doulas need to have a basic understanding of what is a normal pregnancy, what is standard prenatal care, what is the normal childbirth process, what are common complications of pregnancy, of labor and birth? What are common medical interventions of pregnancy, labor, and birth? A basic understanding of breastfeeding so that they can support clients both right after the birth, but once parents come back home, that they can identify, is breastfeeding establishing well, or do they need to refer to a lactation consultant or more back to the pediatrician, or just engaging those community services? Doulas need to understand the normal routine postpartum needs of a new family. As doulas in training, then they need to understand what is their role in supporting families during those prenatal months. What kinds of issues or concerns are coming up so that the doula can help the family work with the OB advocates, with the case managers, with the medical providers, the social worker, the healthcare system to help families access additional services and supports. Because the doulas are in the home, they can see firsthand what are the needs and stressors that are impacting the health of the family in the prenatal months. Once that birthing person goes into labor, then the doula can provide either support in the home in early labor or virtually. And then during labor and birth, the doula can meet the birthing family at their chosen birth setting. and be there for the labor and birth, providing continuous support until the baby is born, the placenta's been born, the baby has latched on, and the birthing family can go into their postpartum room. The doula accompanies the family throughout that entire labor process. Then when the family comes back home, the doula re-engages with the clients and connects with them to make sure that there's food, that they're adapting to the baby, that everybody's doing well. And in those 12 months postpartum, as new needs for the family arise, again, the doula can help the family connect to additional supports and services, providing breastfeeding support as needed as well. I like the concept of a career ladder for doulas, because besides this basic training, there are so many other areas that doulas need to be trained in, such as perinatal emotional complications. What does postpartum depression look like, or extreme anxiety or psychosis, obsessive compulsive disorders, or intrusive thoughts that are common signs and symptoms of emotional complications in the perinatal period? How would domestic violence impact a pregnancy and birth? Actually, when there is domestic violence in the home, it is the most vulnerable time when there's a pregnant person or a baby in the home. It's a very stressful time. And so it's important for doulas to be able to recognize these signs and symptoms. What is trauma-informed care is also very important, because there is so much sexual violence against people that in the birth process, this previous history of trauma can really have an impact during the perinatal experience. And so understanding what is trauma-informed care is very important. A lot of in our communities are struggling with substance use disorders, and doulas, when they have that additional training, can be an important member of the team. We're also seeing high rates of infertility, pregnant and infant loss, and really the impact of sexual trauma in the perinatal period. As community doulas, we strive to train our doulas also in the core competencies of community health workers. So there are 10 core competencies that CHWs that are certified by the state need to demonstrate that they're competent in these areas, and we will be including these competencies in our doula training. So how can doulas address systemic racism that leads to health inequities? First and foremost, I think, is so that the doulas, when the doulas are fully integrated into the healthcare team, we can see a lot of benefits. Doulas need to be trained in recognizing when systemic racism is impacting care, when a microaggression or when the birthing person feels that they're not being respected or heard by their medical provider. The doula can add that voice, that moment of hearing the person and repeating what that person is saying. Because the doulas work with families for a long period of time, they can really get to know their clients' wishes, their needs, their fears, their concerns, their traumas, their past experiences. And by building a trusting relationship, they can really create a safe and supported environment for their clients. When you put a doula into the equation, I really find that the voice of the birthing parents is heard in a way that often may go silent. And as a doula, I believe that we also need to be hearing the baby's voices. Even though they're in utero, they're still communicating their needs. And so doulas can be very honed into this.
Lorenza?
Yeah.
Is there a way this is so informative and I wanted to ask, because one of the things that we wanted to ask also about the policy level as well, but I think perhaps we can move some of the discussion into our Q&A.
Okay.
If that's okay. It's
Great.
Now 11:50.
Okay. So,
So
yeah, let's see, what can I say? So I talked about how UMass Medical is moving forward Is this, I think this is, I have 2 more slides. You want me to talk about what's happening at the state level?
I think we could just put that in the Q&A session.
Okay.
Yeah.
So let me stop the share and join you all.
Again, I want to apologize.
That's okay.
Just for interest of time. And as we talked about, we can include a lot of the great content into our Q&A session. So a lot of the conversations that we've been targeting or been discussing about, as Maritza presented earlier, our first series looked at the root causes and, you know, what a call to equity, right? And then this session 2 is to look at a call to action, like what are we doing? What are organizations involved in this in the support and care of Black maternal women? What are they doing? And so we've heard from our own OB, physician at Family Health working at UMass. We've heard from Penelope at Worcester DPH through the REACH grant, and we've also heard from a doula. A doula trainer and a doula with all of this wonderful knowledge, with the breakdown in terms of how they're recruiting diverse doulas, and also how the approach can be integrated into the healthcare system to really support Black maternal women. And so this is a Q&A session for the entire community here. And this was very informative and beautiful slides and everything. And we now want to open it up to folks to ask questions. And I will read out those questions. And while I wait for questions, I do have one question for Lorenza. If you can just, talk to us a little bit about how does the Massachusetts policy impact the care of doula, that doula provide, and is affordability for all, something in question right now in terms of accessing this, and so how is that approach really accessible, especially for low income women of color in obtaining care? Because we want, this is fantastic work that folks are doing, but we want to understand how does it work, how is it accessible for women of color, Black women and women of color to be able to obtain these services.
I mean, right now in Massachusetts, access to doula care is available to people who can pay out of pocket. And we know that that is a problem for communities of color. So the work, all of the efforts that we are investing in is to break down those barriers. I've been doing this work for like 25 years, trying to see when can we get our healthcare systems to cover the cost of doula care. And finally, that shift is happening. I want to credit Serena Williams and Beyonce for raising awareness when they were pregnant that they almost died and nobody was listening to them, even though they had all the money to pay for services and doula care, they still were not being heard. And so finally, with the health inequities that are so glaring, our healthcare systems and our legislatures have shifted and have said doulas can make a difference. So Mass Health, so there's a legislative bill in the state legislation right now that is working its way through. It's in the Ways and Means Committee being reviewed, that they're talking about reimbursing doula services for all Mass Health families in the state of Massachusetts. Mass Health is also saying that as of 2023, they already obtained a special waiver and that they will be covering services for doulas. We still don't know what that amount is going to be. As a doula trainer, I worry because once Mass Health starts to cover that service, that's amazing, that's wonderful, but do we have the workforce ready to provide those quality services, that culturally competent, linguistically relevant service? So that's why I'm thrilled and excited to be working with the city of Worcester in being proactive in recruiting the doulas and training the doulas and integrating them as OB advocates in the community health centers, but also bringing doula care to UMass Medical. And so I feel that through this REACH grant and these efforts, we will be ahead of the game so that when the reimbursement is possible, UMass and the community health centers will be able to bill Mass Health for those services. So it's a very exciting time. It's an exciting time because then we can be doing more recruiting and more training of community people who want to enter into this workforce.
Thank you. And we have a question that I believe you've already answered about the pay scale for doulas, in which you mentioned that nothing, such information or such detail had not been determined yet, because the bill is still in Ways and Means. So, you know, all of that have to kind of come into fruition in order for there to be a determination of pay scale. But we are, and through your answer, you didn't mention that. So do you want to add a little bit to that?
Yes, I mean, those of us who are doing the advocacy work are advocating for definitely a living wage for doulas, where in other states they tried and the reimbursement rates were so low that doulas could not afford to work as doulas, and therefore they did not step into those roles. So we're really trying to shine a light on the importance of sustainability and living wage for the doulas, that we need to invest not only in birthing families, but in the doula community, because if we strengthen the family of that doula and give her a way of working and supporting her family, we're strengthening the community and improving birth outcomes. So it becomes a very beautiful win-win for everybody. And so we are making that case that it is a living wage. We are working with UMass to say if you're hiring the doulas and they're working full-time, they should get benefits, they should get vacations, they should get a living wage, a living salary. And so those are the efforts that are happening, and I think we are being heard.
Thank you. And my next question is for any of the two panelists that have not spoken yet, including Lorenza. We've discussed a whole lot about, you know, the healthcare worker that supports the delivery and care of mothers, and we've talked about how such information and education should, you know, be before, you know, mothers or women are thinking about or considering childbirth. And we've also talked about, you know, the midwife support, and we've talked about the team birth boards, and these are strategies, right, that are being put in place, and even the doula training that the city is currently doing, and is successful at recruiting diverse doulas that will be integrated into the healthcare system. So the question is that, my question, or the question being posed, is that we have all of these strategies, and how do you think these are going right now in terms of just, you know, putting these together, the structure together? How do you think, in your own word, how do you think that this approach is going in terms of meeting the needs of, you know, pregnant women, especially locally here in our city of Worcester? And that's just one person can answer this question, please.
I think, at least at UMass Memorial, I think things like team birth is definitely at least giving a voice, right? If patients are comfortable, right, they're encouraged by the nurses to go write things on the board, but that's giving a voice, like to say how they want to be referenced as. Like, we've had patients of the LGBT community, and then they can put their pronouns on the board, they, and I just feel like they are able to have more of a voice in their care, and then it's actually documented. They can go up there and write it. So anyone who walks into the room knows that. They're writing the names of the team members, so they can, you know, they don't have to remember all these different people coming into their room, and their names are updated when the shifts are changing. And I feel like that's a big thing for a woman of color, to feel like they have a voice, feel like they're heard. I know we're making better efforts of using interpreters for non-English speakers, and we're continuously trying to train, right, our staff to use it correctly. So one thing to use interpreters, but you have to use it correctly. You don't say to an interpreter, "Oh, can you tell her that you look at the patient and you talk to the patient, and the interpreter just interpreting you." And I think the amount of motivation, I feel like, that UMass Memorial Maternity Center and the community OB providers, Family Health Center of Worcester and EMK and the UMass OB clinics, seem to have to improve the maternal health of all women of color, is going to keep the momentum going. And I do feel like, I'm pretty sure the maternity anti-racism task force wants to specifically attack the issue of this recent influx of refugee, Haitian, Portuguese immigrants that we're getting, and a lot of them are coming pregnant, and how to better deal with that. And a key thing we have to do is all these community agencies, someone in the chat just named none, and we have to connect, right? So we all know what we're doing and share the ideas.
So thank you, Dr. Pierre. And Jermoh's going to now bring us to the closing and make her call to action to the community who's here with us. And I just want to thank all of you for being here for this most excellent and informative presentation on behalf of all of the panelists. So Jermoh.
Thank you. So thank you, panelists. Thank you, our audience, for being here. So this is a call to action, and looking at the local level, we are calling our local public health department to focus on Black maternal health as well. We are hoping that after the 5 years of such great work being done in the city, we're able to use certain data to reapply for the REACH grant to include that community. We also would appreciate the hiring of staff, BIPOC staff, to work on the grounds, especially with work on the grounds, and then work also with community-based organizations to reach hard-to-reach population, especially Black maternal women at the community and community-based level. And that includes organizations such as the YWCA, MCA, all organizations, Together for Kids Coalition, thanks for being here, and key stakeholders, as well as the medical community, UMass and Family Health Center, to really engage them in the research, right? The root cause, and in ways in which systemic racism influence delivery of care, to work with the medical community and public health department to design programs to educate Black maternal women who are of childbearing age until the postnatal stage. At the state level, our wonderful speaker panelists mentioned the doulas. There's 2 bills that is in the House, and we're going to share all this information in our email that Alyssa, for the YWCA would put out. There's 2 bills, H 2372 and H D1547. These bills are an act relative to Medicaid coverage for doulas. We're asking that everyone here as an advocacy to please call your state representatives to support this bill, and to not only support it, but also keep watch of it as it goes through the process. And we on the community-based side, can share information of that bill and ways in which that we can all be supportive, and in terms of reaching out to our elected officials here in the city, and also in Massachusetts as well. And for the goal of doulas to be integrated, properly compensated, and properly trained, and also properly integrated into our healthcare system as an approach to curtailing the deaths of Black women. So I want to thank you. Again, my name is Jermoh Kamara, and I'm the Wellness and Health Equity Director at the YWCA.